Hypertension, often known as high blood pressure, is a widespread disease that has a substantial global impact. It can cause major health issues like heart disease, stroke, and renal damage if left untreated. There are a number of natural approaches to regulate high blood pressure, even though in some circumstances medical assistance may be required. This article will examine several dietary changes and at-home therapies that can assist in efficiently managing hypertension. A nutritious diet, 200 words. Maintaining a balanced diet is one of the most important aspects of controlling high blood pressure. Following are some dietary recommendations. Limit your intake of processed meals, canned items, and fast food because they often contain a lot of sodium. Aim for a daily salt intake of no more than 2,300 milligrams. Increase your consumption of potassium by include foods like bananas, oranges, spinach, avocados, and sweet potatoes in your diet. Sodium's effects on blood pressure are mitigated by potassium. Limit your consumption of cholesterol and saturated fats. Exercise frequently, 200 words. Regular physical activity is essential for blood pressure control. Here are some suggestions for exercises. Aerobic activities. Spend at least 150 minutes per week exercising, such as brisk walking, running, cycling, swimming, or dancing. Strength training. Include resistance training at least twice per week in your routine. These exercises could involve lifting weights or working with resistance bands. Be consistent. Rather than random, intensive workouts, aim for frequent exercise sessions throughout the week. Management of weight, 150 words. In order to control high blood pressure, it's crucial to maintain a healthy weight. If you are fat or overweight, even a slight weight loss can significantly lower your blood pressure. For help achieving and maintaining a healthy weight, combine a balanced diet with frequent exercise. Reduced stress, 150 words. High blood pressure can be exacerbated by ongoing stress. Utilizing stress management strategies can assist in controlling hypertension. Think about the following tactics. Use relaxation techniques. To induce relaxation and lessen tension, try deep breathing exercises, meditation, yoga, or Tai Chi. Put self-care first. Schedule time for your favorite pastimes, such as reading, music listening, or spending time with loved ones. Get adequate rest. To improve general well-being and lessen stress, aim for 7 to 9 hours of high-quality sleep each night. Don't drink too much and stop smoking, 150 words. Smoking and excessive alcohol intake can both raise blood pressure. Limit your alcohol consumption to moderate levels, 1 drink for women and 2 for males per day. To lower your blood pressure and enhance your general health, stop smoking completely. Maintain blood pressure monitoring, 100 words. Utilize a dependable blood pressure monitor to routinely check your blood pressure at home. This will enable you to monitor your development and spot any changes that might call for medical treatment. To find the ideal goal range for your blood pressure, speak with your healthcare professional. In conclusion, controlling high blood pressure naturally necessitates a multifaceted strategy that includes a balanced diet, consistent exercise, weight management, stress reduction, moderate alcohol use, and quitting smoking. These lifestyle changes can help to greatly lower the risk of linked health issues and control blood pressure levels. Keep in mind to speak with your healthcare practitioner for personalized direction and assistance on how to handle your particular issue. Do you struggle to maintain high diastolic blood pressure? However, there are a number of ways to reduce your general blood flow. Either you need to alter your way of life or your regular workout regimen. However, if you have high diastolic blood pressure, you won't be able to treat your main issue. You'll need to work closely with your doctor, MMHG, to reduce your diastolic blood pressure while keeping it from dropping below 60 millimeters of mercury. Your risk of getting heart disease increases and your heart may suffer as a result of low diastolic blood pressure. Learn about hypertension and some techniques for decreasing your blood pressure in the sections that follow. Introduction. If your blood sugar is elevated, you might wonder if you need medicine to lower the reading. The patient's lifestyle must be changed if diastolic blood pressure is to be controlled in a high blood sugar condition. A healthy lifestyle can help keep blood pressure under control, which may prevent, delay, or reduce the need for medication. The probability of acquiring high blood pressure, or hypertension, increases with age. However, exercising regularly can be quite beneficial. If you already have high blood pressure, exercise may help you control it. You don't have to start working out right away or register for a marathon. Start out cautiously and add more exercise to your daily routine over time. Tell us about your efforts to regulate your blood flow through exercise and a healthy lifestyle. Does physical activity lower blood pressure? Although there is a misconception that those with high blood pressure should avoid exercise, exercise can generally assist you control your diastolic blood pressure. Yes, it's true. Regular exercise will help you regulate your weight, keep your heart healthy, and keep your blood pressure elevated. So why are you still waiting? Put on your shoes, and if you want to stop taking the expensive medication, start working out. You must pay attention to your breathing when working out and avoid holding it for long periods of time. A 5 to 10 minute warm-up and cool-down session is required. Ride a bike, walk on a treadmill, walk a track, or go for a stroll in your neighborhood to warm up or cool down. For example, you can warm up or cool down while exercising by riding a bike, walking on a treadmill, jogging a track, or simply taking a stroll around your neighborhood. It aids in preparing your body for workout. In addition, if you do not relax after working out, your blood flow can decrease. Your heart may continue to beat more quickly as a result of your blood vessels becoming dilated from vein pooling in your legs. So, it's essential to cool off if you want to prevent hypertension. How much exercise should you get? You should exercise for 150 minutes each week at a moderate level. However, that 150 minutes might be split up into smaller, more manageable chunks throughout the week. Set a goal to work out for 30 minutes or more most days of the week. Experts advise starting with 10-minute chunks if you're just getting back into an exercise routine. Consistency is crucial, and it can take 1 to 3 months before you notice a change in your diastolic blood pressure. Make sure you are working out hard enough and aim for a heart rate during moderate intensity activity that is roughly 50% of your maximum. Another easy method to decide if you should work harder or take a break is the speaking test. While utilizing a treadmill or while walking, you could hardly talk more than a few words. You certainly couldn't sing or have a meaningful conversation. The 8 best exercises for lowering blood pressure. By strengthening your heart through cardio and strength exercise, you can pump more blood with less effort. The ability to alter your life through exercise only occurs when you are committed to it. The following are the 8 best exercises for lowering blood pressure, so try them out if you're ready to manage your high blood pressure. Swimming. Freestyle may be the easiest stroke to learn for beginners. If you find that particular stroke to be too challenging, try aqua jogging. To improve buoyancy while jogging, you can also use pool noodles or an aqua jogging belt. Weightlifting. It seems strange, but lifting or doing weights can lower blood pressure. Strength training can temporarily raise blood pressure, but general fitness can also cause blood pressure to drop. Pedal pushing or desk jogging. A study indicated that participants' blood pressure measurements were much better if they pedaled stationary cycles under a desk or walked for at least 10 minutes at a leisurely 1 mile per hour pace. Hiking. Because it keeps you in shape and lets you explore more, hiking is the greatest sport for persons who are adventurous or have high blood pressure. Cycling for 30 minutes every day, either on a stationary bike or in 3 10-minute intervals. Cycling or 30 minutes of walking is the holy grail for patients with high blood pressure because it maintains them in shape and regulates their heartbeat. 3 times every day, for 10 minutes, walk briskly or moderately. By allowing blood to flow more freely and relaxing blood vessels, exercise lowers blood pressure. The benefits of exercise are most noticeable during and immediately after a workout. After exercise, blood pressure reduction is most pronounced. It is preferable to stop working out for 10 minutes at a time. It may be most efficient to spread out your exercise over several different periods throughout the day, according to experts, to control high blood pressure. 3 10-minute walks a day were discovered to be more helpful at lowering blood pressure in the long run than a daily 30-minute stroll. Dancing. Participating in a dancing class like Zumba is the best exercise. It is appropriate to dance in any way that involves full body movement and increases heart rate. Cycling. Cycling qualifies as exercise if you do it for at least 10 minutes per day. Even if you have high blood pressure, cycling is the best exercise to maintain fitness. The top 15 foods to eat to lower blood pressure. Tangerine fruits. Fatty seafood such as salmon. Geneva chard. Squash seeds. Lentils and beans. Berries. Amaranth. Pistachios. Carrots. Celery. Tomatoes and tomato-related goods. Broccoli. Grecian yogurt. Spices and herbs. Flax with chia seeds. Conclusion. You can lower your blood pressure in a number of ways, including by changing your lifestyle and taking medications. You cannot solely concentrate on reducing your diastolic blood pressure, it is crucial to highlight. You'll need to lower your overall blood pressure. Make sure you have planned exercise rather than merely physical activity when it comes to sustaining a healthy lifestyle and making improvements. If you have high blood pressure, discuss it with your doctor, and you can create a personalized treatment plan together. Question and answer sheets. What is the technique to lower blood pressure? Change your eating habits and begin a healthy diet. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, can be used to lower blood pressure. Try keeping a food journal and noting your meals. Eat more potassium-rich foods. Potassium can help to lessen sodium's negative effects on the body. What types of exercises are to be avoided when blood pressure is high? You should avoid physical activity that causes your heartbeat to spike suddenly if you have high blood pressure. Weightlifting, skydiving, squash, scuba diving, and running are a few examples of workouts that patients should avoid since they can fast raise your heart rate and cloud your consciousness, which may cause elevated blood pressure patients to experience a heart attack. How can I rapidly lower my blood pressure? Outside of a medical environment, blood pressure cannot be lowered. Exercise, a healthy diet, and stress management skills can all naturally lower blood pressure over time. How do I drop my blood pressure in 5 minutes? In order to drop your blood pressure in 5 minutes, you must immediately take a warm bath, start breathing exercises, and make an attempt to calm your mind while practicing yoga, meditation, or listening to calming music.